Hi, this is Matt Sones from Compass Care in Rochester, New York. Excited to demonstrate a little bit of what Optimize is. Optimize is our new patient software tool. It is a combination of an electronic medical record, keeping your patient's records electronically, a BPM workflow tool, business process management tool, which effectively guides your staff through their workflow processes, through their engagements with patients. And it is a database with real-time analytics and reporting features. So it is all of those things combined into one tool that your teams can use as they interact with patients. It's built on a Salesforce.com platform. Salesforce is the world's #1 customer relations management solution. And they also give away 10 free licenses for nonprofit organizations to their Enterprise Edition. So it is an excellent platform for this kind of solution. It has the best security around. Everything is in the cloud, so you don't have to worry about data ending up on any of your local systems. HIPAA is no concern. It is a concern, but it's well met with the Salesforce platform. It is almost infinitely flexible. So one of the really great things is that you don't have to change the way that you serve your patients in order to fit it into a new linear service model system. We can customize Optimize so that it matches the way that you serve your patients, because we know everyone does it a little bit differently. It is a big efficiency improver. No double data entry. You're entering data in line with your service of patients, and it improves efficiency in terms of staff training as well. Your new staff learning how to perform their tasks and roles will be easier because those things are built right into the software system. Professionalism we've seen at Compass Care since we launched 3 months ago now. The response of patients, they've been surprised and impressed with our professionalism and the way that we interact with them and with our electronic systems. Patients expect their medical providers to have electronic records these days, and it's great to be able to meet those expectations and exceed them in some ways. And finally, and probably most importantly, Optimize is a continuous improvement tool, and in joining Optimize, you join a network of centers around the country that are working together to find the very best way to serve patients. So with Optimize, you'll be able to compare slightly different ways of doing things within your own organization or across organizations. And say, you have a process that includes on step 3 a certain script. Someone else has a different script for step 3, and their script is performing a lot better in terms of patient outcomes. It's as easy almost as turning on a switch to adjust that script so that you can have the best performing script in the nation. Those are some of the brief benefits. I can talk a lot, but I'd love to just show you a little bit of what Optimize looks like, so you get a real picture of what we're talking about here. The first step is our scheduling interface. This is the first time you interact with the patient, and your scheduling team, when they're answering the phone, has a calendar right in front of them. Whether it's on their mobile phone or on a computer, they can access the calendar. They can see their scripts for how they should talk to the patient on the phone right here. These are all completely customizable. And when they're ready to schedule an appointment, we can just click on the appointment, enter any notes, something like caller was crying on the phone. That might be important about the call itself. We'll enter a test patient, something like Jane Jones, and her date of birth. We'll get her phone number and her referral source. She's a pregnancy patient. We can call and text her. We can leave a message. Her LMP was back in October. She plans to abort and is abortion-minded. This is an initial appointment. Some notes for the nurses can go there, and we'll schedule the appointment. We see that there's already a Jane in our database, but Jane Jones is not Jane Doe, so we'll schedule her for a new appointment. And with that, we've scheduled the appointment. It's as easy as that. Now when we come over to our nursing app, before I get there, quickly, performance for the schedulers is in real time, so they can see, their schedule rate this week. We don't have a whole lot of data in our demo environment right now, but there it is, 88% schedule rate. If you're just looking at pregnancy appointments, that's an 86% schedule rate. Of course, we do confirmation calls, so we'll see this entry was made for Jane Jones to call her the day before her appointment to confirm her appointment, or text, or however you reach out to your patients. And that can all be customized according to your needs. We'll take a look at what the patient sees when they walk in the door. I'm emulating an Apple iPad here, and we'll see Deborah has a appointment scheduled today. She's come in and she will identify herself with her date of birth or her phone number and then register. And so Deborah can read through and sign or type her signature. On a tablet in your lobby, and walk through all of your reports, give her information about her name and address and those sort of things. In your anything you have, any paperwork that your patients fill out in the lobby can be filled out right here on a tablet. When it's your nurse's turn or your advocate's turn to launch the appointment, we can see here's Deborah's appointment. We're just going to go ahead and start the appointment. This would be something that you would do on a tablet that you're carrying. And we'll walk through an entire appointment. So, we'll reminder to pray for the patient. I won't show you every single step, but we just go through step by step, get details from the patient, an intake form, ask typical questions. What brought you here today? Have you taken a pregnancy test before? When did you take it? And it was a home test that was positive. So you're clicking through, and there are scripts here to remind you of what to say at each step. So how do you introduce the abortion brochure? There you go. You do a pregnancy test, and when you get to ultrasound, there's a consent form for the patient to sign, and they can just take their finger and read through it and sign. And you've captured her signature electronically in a secure way. When you get to her resource list, you can customize all of these options that are available to her. Anything that you want to add resources to her customized patient resource list, you can check those off and add them to her list and save them. Evangelism. And then closing. If she needs to come back for a return appointment, we'll just schedule that right in the room with her. We'll find a date in, the next week where there's room that she's available to come back, and we will schedule a return appointment for 30 minutes. There it is. We can print her resource list. We can print her verification of positive pregnancy if she needs that for insurance purposes. And we always want to provide feedback. One of the keys to optimize is continuous improvement, and so we want to know what went well. How could we enhance it? Any additional notes that the nurse or your staff has about the appointment itself, and a signature for your team member there. And we're all done. That's a really quick view of an appointment, but that's what it looks like to walk through step by step with your patient, and look at your scripts as well as your steps, with the software leading the way. We also have ultrasound reports, so that you can enter your input your ultrasound images right here. I've already uploaded these, but the upload process is very simple. For those who have red flags in their head about HIPAA violations of what you're seeing here, this is my baby. So feel free to ooh and ah with a clear conscience. She's now 5 months old. So you can upload your ultrasound images. Let's see if we can do another one here. Here's some ultrasound images, and we'll just drop that one right there, and it'll show up at the bottom of the list. So when your medical director comes in to sign charts, they can do it from any computer or tablet anywhere. So this chart is in the medical director's queue to review. The tab where his or her attention is needed is highlighted in red so that the medical director can see exactly where her input is needed. She can sign, read the scans, take a look at these in a bigger way if she needs to, overview the nurse's notes, the health assessment. If you provide STD testing and treatment, can take a look at that, and then sign when she is ready to confirm the pregnancy or review the chart. And it is as easy as that. And finally, we'll move on to reports. Lots of exciting reporting features. This is a typical master report for a pregnancy process. A summary of all the key indicators for your team. And this is completely customizable. One of the great things about the master report is that we can do drill down reports. Any of these sections, you can click on the title to see more information about who these specific people are. So for example, we'll click on evangelism and see the details related to those patients that were indicated on the report. Lots of other reports are available. Seeing the nursing dashboards and the scheduling dashboards. Patient details will show, ethnicity, education level, and patient age information. These are all up to the minute, and you can see last month, this month, all year, all time, etc. If we want to see where our patients came from, online, friend and family, college, television, easy report there. that can help you with your marketing. And, just for an example of other things you can do in terms of reporting, how long were your appointment processes on each tab? So it looks like we've been spending a lot of time on the intake form, and not very much time on the other tabs of our process. Second longest is the health questionnaire. This is just an average time in minutes per tab. So those are the kinds of things that you can do with reports. Very flexible. You can report on anything that you're capturing, and you can capture any data that you'd like. To reiterate, this is a very flexible tool to help you manage all of your team's workflow, from the initial contact with the patient on the phone through to, follow up as long as you'd like to follow up with her. If you have any additional programs that you do with her, those can all be tracked in an easy to organize way. Just really, really simple and easy to use to streamline your processes. The nurses at Compass Care who are using it now, after 3 months, are really loving being away from the old paper system and being able to be on an electronic system that manages a lot of the workflow for them. So thank you very much for listening, and please feel free to contact us at optimize@prcoptimizationtool.com or visit us on the web, prcoptimizationtool.com.